Okay, everybody, if you're watching this recording, you were unable to join us today for our cohort check-in. This meeting was on Thursday, July 31st, and we were talking a little bit ago in a non-recorded portion about marketing letters. We're asking everybody to put together a letter to their clients about the services that you can now offer. If you haven't sent that to me, please take a minute to send that to me so we can get you some feedback and coach you up a little bit on that. We want to spend a little bit of time today talking about our meeting presentation timeline. And so I'm going to send you in our follow-up email a PDF of this specific page that we have up right now. And that will give you this as sort of an infographic that you can have printed out on your desk or in your office. We repeat the same exact formula over and over again, almost without fail. And the reason is we have perfected this model over decades in the industry, combined experience probably well over 100 years, even though it's multiple people overlapping, right? And so what we basically do in our meetings with our clients is, number one, we teach them about original Medicare. In your partner portal, we have a document that we went over last week as well. It's right here. It's the 2025 Medicare cost and IRMA. We have laminated copies of this in our offices. And we go over these benefits with our clients. We explain to them what Part A is. Part A is hospital insurance. It's going to cover your costs associated with confinement in a hospital or skilled nursing facility. We go over these benefits. We just read it. 1 to 60 days in the hospital. Most confinement costs after the required Medicare deductible are covered by Medicare, but you must first pay a $1,676 deductible. We will then slide into 61 through 90 days and what those costs and co-payments are. And again, we're going to have a much more detailed training on how we talk about this, but we truly just read it in a short form version. We explain 91 days through 150 or 838 a day, and that these are lifetime reserve days. So what does that mean? If I use one from that category any year, it comes off the bank and I can't use it again. So I have, 91 through 150. Those are my lifetime reserve days. It's like a sick leave bank, so to speak. If I'm in the hospital in a year for more than 150 days, I, as the patient, have to pay all costs at that point. This deductible is also problematic. It is not annual. It is per benefit period. You'll see that down at the bottom of this form. So if you've been discharged, 60 days later, a new benefit period begins. So I could, in theory, go to the hospital in January, pay $1,676, be discharged in 3 days, come back 3 months later and pay $1,676 again. In theory, be discharged, come back 4 months later and pay $1,676 again. There is no out-of-pocket limit for Medicare Part A. I'm going to say that again. There is not an out-of-pocket limit for Medicare Part A. We then go over Medicare Part B. Why? It's next. A, then B, right? Medicare Part B is medical insurance and covers doctor services, outpatient care, tests, and supplies. Until you get comfortable, just read it. Expenses, what Medicare covers, what you pay. This is different than Part A. Medicare Part B has an annual deductible amount, and this year is $257, after which Medicare covers 80%, please never say, of all medical-related expenses. That is wrong. 80% of the Medicare-approved amount. Never say all medical-related expenses. It's easy to do, right? Because look at right here, this says medical expenses. But not all medical expenses are covered. It's only what Medicare approves as being covered. But generally, most physician services, outpatient therapy, surgery, imaging, blood work, physical and speech therapy, diagnostic test, urine analysis, home health care, certain home health care, outpatient hospital treatment, blood transfusions are covered with the member paying 20%, Medicare paying 80%. And again, very clearly stating to the client that with Medicare Part B, there is no out-of-pocket limit. And so we then have the excess doctor charges. This is important state to state. You have to look up your state rules. I don't have them memorized in every state. In Ohio, most providers are not allowed by Ohio law to charge an amount above Medicare, above Medicare's limit or their approved amount. In other states, they can. It's called excess doctor's charges. They bill above the Medicare amount. And even if you have Medicare Part B, you're responsible for all cost of excess charges above the Medicare amount. A question in the chat on these numbers: when can we expect the 2026 to be uploaded to print and laminate? Interesting question and a more problematic answer. We don't know. So Medicare Part B and Medicare premiums are a political football. And so they're utilized based on the political party in power as a ticket for things like the midterms, a ticket for things like the presidential elections. If these numbers are going to be good, we usually learn about them early. If they're going to be bad, we usually learn about them late. Last year, we did not find out about these numbers until almost October because they went up. The midterms a few years ago, we found out about these numbers early September because they actually went down. So as soon as we have these updated numbers, we'll create a new infographic and make sure that you have access to that. Very good question. So that's what we do. We go over Medicare Part A and Part B, and we say, do you know anything about your Part B premium and your income-related monthly adjustment amount? Folks, we do not become financial advisors in this moment. It is not our job to figure out somebody's tax return. We're not going to look at their tax return as insurance agents and try to figure out what their modified adjusted gross income is. We are simply going to present this and maybe give them a copy and say, it's important that you know that your Part B and D premiums vary by income, and that for 2025, they're based on your filing status and yearly income from 2023. And you can say, take a look at the chart, and you can roughly, as the client, maybe tell me where you think you might be in terms of your Part B premium over here and your Part D premium. And you're going to get asked, you're going to run into people, and if any of you are approaching Medicare age and you're an S Corp, you may well be in one of these higher Part B premium categories because of your tax status as a company. You're gonna want to know, your clients are going to want to know. So, oh boy, here's the standard Part B premium, 185. My income as an S Corp puts me down here, which means I have a 185 Part B premium, say 110. I'm going to be assessed $590, $190 a month for my Part B premium. The next question they're probably going to ask you is, how do you pay that? The Part B penalty right here is added to your Part B premium, and you either pay that directly to Social Security office. They bill you quarterly. You can set up monthly payments. If you don't have a Social Security retirement benefit yet, if you have a Social Security retirement benefit, that amount will be deducted every month from your Social Security benefit. The Part B premium plus the penalty amount, or the adjustment amount is probably a better way to say that, not penalty. Over here, they're also going to tack on $78.60 to whatever Part D plan I have. So if I have a standalone drug plan, they're going to add $78.60 to my premium. If I have a Medicare Advantage plan, including prescription coverage, they're going to add that to my Medicare Advantage plan premium. That is paid to the carrier. That additional amount is paid to the carrier on top of your premium. So why do we start with this? Why is it paramount for us to go first over original Medicare and the IRMAA amount? Because if we don't teach what those are, they don't really know why they need us. And Brian put in the chat very astutely to show the problem that we need to fix. And the number one problem you've probably picked up on, the number one problem by far is no cost containment. Part A and Part B have no out-of-pocket limit, right? And so we have to fix that problem. We have to provide a solution. And that's where we come in as agents. And so we are then going to go into the process of how we help them evaluate whether they're going to go with a Med Advantage or Med Supplement plan with a standalone drug plan and a standalone dental or vision plan. That's option one. Or option two, a Med Advantage plan, which includes Part D and extra benefits. And depending on how far we are in our journey as brokers, we might even put an indemnity plan in the works for them on this coverage model. Because we're going to help them decide, do they want a supplement pay now or an advantage pay later? Do they want a monthly premium that has more cost, or do they want a lower monthly premium? Do they want a plan that covers almost everything so they know kind of a fixed income mindset without surprises? Or they want to be more variable and have to pay copays, deductibles, and coinsurance? Do they want no network and they can go to any doctor in the country or facility that takes Medicare, or are they okay living in a network? Do they want to pay for a standalone drug plan? We'll talk more about those costs today. Or do they want a plan that's all inclusive? Here's one. On the supplement side, do they want to carry around 3 or 4 cards in their wallet all the time? Right? Some people, that is honestly the thing that puts them over the edge. I can't keep track of 3 different carriers and 3 different insurance cards versus that typical healthcare plan card. So before we get into the SmartEnroll portion for today, just for distinction and clarity, MedSup is the weird option. For some people, it may well be the best, but it's definitely weird. It's definitely foreign to our clients. Most of us have never had the opportunity until Medicare age to get our coverage through the government, have the government approve our procedures almost with a rubber stamp, no prior auth, and have the government paying those bills on our behalf, and then supplementing that with a secondary policy. We all know what Advantage plans are. So when you present Advantage plans, don't overcomplicate it. They're just really, really good versions of insurance plans like we had during our working years. That's it. They're not that complicated. It's the MedSup that's very foreign in its design and in its coverage model to most of the people that we're going to interact with. So let's go back to our little timeline. So we've gone over number 1 and number 2. So we've gone over these 2 pieces, and Jen, I see your comment in the chat. I will be sending you this chart as a resource later today. And even though it's on the Erie website, I will also send you this Medicare cost sheet. I'm going to download it from my email right now. So we now have to go into our next step, and we go from this into MedSup education and presentation. Why? Well, I'm going to show you. So I want to point your attention to one other thing that's on this website. It's right here. the enrollment walkthrough guide. Don't yell at me about any broken links. I haven't updated this yet because, to Jen's point, I don't know 2026 Part B information and all that. I made this to kind of be this comprehensive guide that walks you through the enrollment process. Is it perfect? Probably not. Is it close? Most likely. We labored over this. What do you do from start to finish in the enrollment process? There's links to forms, resources, videos. Again, if a link is broken, forgive me. I haven't cleaned this up yet for the new year. It will be as soon as I get that Part B information. But everything from steps before the meeting, things you should do before the meeting, how you do them. And here's where we're at right in this sequence. So we've gone over original Medicare. And here's that chart, right? Is it going to open? Yeah, there's a link right to that chart. So I'm not going to keep clicking back and forth, or it's going to lodge me out. But there's links to a lot of the things that I'm going over with you today. And so we are next going to teach them what a Medicare supplement covers. And so the way that I like to do that is I like to use carrier books because it has the chart. And it has things like this in it, right? You can use the links in this document that I'm going to share with you that we're looking at right now, this guide, because I want to be able to show them, okay, we've gone over A and B. One option is to have a supplement plan. Let me show you the different plan options available through the government. Because med supplement plans are the same with every carrier in terms of coverage. They only different price and extra benefits, right? Most of my clients are on Plan G. Why? Plan G is for good. It covers something that no other currently available plan covers, which is Part B excess charges. Sound familiar? When we went over Part B, we talked about excess charges and the fact that if I have Part B, I'm responsible for 100% of excess charges. If I have Plan G covers those excess charges. So that document is linked for you in this in this plan here, or in this guide here. I put in here for you as an example. Let's see if this opens up or not today. Nope, it's not going to load. Like I said, sometimes I don't know what it is, but these links just time out, even though they work. So you can download from Agent Exchange the Erie MedSup outline of coverage. And I would highly recommend you do that. Let me see if I have it somewhere else real quick. Bear with me. I might have it in here. Yeah, I will figure that out later. I don't want to burn too much time here. I'm not seeing it. So while you may want to have that document on hand, and again, you can find that in your Agent Exchange account. Oh wait, here we go. I knew I had it. Jeez, oh man. Yeah. If you have this printed off, you're going to have that comparison chart for the different plans right here. So some people will go with Plan N. It's similar to G, but you have copays as you see right here. I don't personally write that a lot. I pretty much always write G or Advantage plans. But you can learn about N. There's some, additional information on the copays down here for N. The big drawback for me for N is not the copays. It's that nobody but Plan G covers those excess Part B costs if you were to incur them. And where that kind of matters is like if you live in a state that doesn't really allow excess charges, but you travel into a state that does and you need the ambulance and you have to go to the hospital, and that state can bill above Part B permissible amounts, you're now paying excess charges at 100% because you have Plan N instead of Plan G. But why we want to have either one of our carriers, they give you books for this, or this Erie guide, is this is a really great way to show what Plan G actually provides, because we just went over a chart that looks identical to these first three columns right here, right? We presented in a non-plan resource column 1, 2, and 3, and now we can quickly say if you have Plan G, here's your Medicare A benefits that we just went over. When you add on Plan G, look what you end up paying. So we're laying the framework very deliberately using that non-carrier created resource. All Part A expenses that are Medicare approved are covered under Plan G at no cost to the member outside of premium. Same thing with B. We have the same chart, same columns with this fourth column added for you pay. You can see this is from last year. This is the wrong Part B deductible. But when you have Plan G, all of your Part A and B expenses are covered except for the premium and the Part B deductible. And they're like, oh, wow, that's pretty amazing. Like, I don't have any out-of-pocket expenses. No, you don't. Not after that Part B deductible has been met one time for the year. So that's pretty amazing, but we're missing some pieces here, right? We're covering A and B. What are we missing? Dental and vision, routine dental and vision, not medical dental and vision. We're missing prescriptions at the pharmacy. And those are pieces that we have to contend with. So what we can do now, let's take a look at our enrollment platform. So we've now shown the client what a med sup is. Let's find out how much a med sup costs. So with our enrollment platform, I started today directly with the sales process. There is a step that we're going to teach you in our August trainings on how to do before everything that I just talked about. When I schedule a meeting, I create a new beneficiary. I put in their zip code. I do this, or somebody on our team does this at the point of scheduling the meeting. We enter in their information on this simple demographic screen. Address, save. And then we can add in preferences. I'm not going to go over scope of appointment today. That's for another day. We're looking at how we work with clients. In the preferences, I can enter providers. Very easy to do a quick search. I showed you guys a little bit of this last week. I'll just put a couple people in. It doesn't really matter, just for demonstrations. We'll do everybody whose name is Jones. Sure, why not? You're my primary care. I can click continue. I can preemptively add their medications. I'm going fast. We want to get the concept. We will drill down in this in that 4-part webinar that's coming soon. So don't panic. This is to give you the big picture idea and help you to start to visualize it, okay? We'll put in a couple of standard medications. We'll do everybody's, my clients now always call and ask about Ozempic. I feel like it's every day. Pharmacy, sure. We'll add a couple of local pharmacies here. Okay. All of that work I could have done before I met with them. I could have done all that over the phone, asked for their medications. I personally like to do their medications in the in-person meeting rather than over the phone, but you could do it over the phone. I like to have them bring me their pill bottles so I can actually read it myself and not have to read their list or have them try to explain it to me over the phone. But in here, across the top, we now have their name is here. Their zip code is loaded. And I can take a look at med sup plans right here. I pick an effective date, a gender, how do they want to pay? I'm going to go monthly. Are they going to sign up a spouse? Are they going to use electronic fund transfer? Part A and B effective date. Have to re-add this here. Now this system only shows the carriers that you're contracted with for TLC. and it does not show Erie. Erie has a different security protocol, and we cannot quote Erie in this platform. So what I usually do for med subs, my method is I just download rate sheets and I still keep a binder. To me, that's the easiest. I don't have to click around in here. I can quickly show my clients the different rates. But if you want to use this, you can. You just have to look up Erie separately or have a rate sheet on hand. I can click Plan G over here, and I can sort the plans in my area low to high. I can quickly show my client the difference in premium for all these different carriers and the Plan G. And if they want to go with one of these, I can go ahead and click Add to Cart. And now it's in the cart for the application. And I can now go right into, look at this, adding a prescription drug plan. So let's do that. Let's click Shop for Plans. Again, we're going to get more into this, but one thing that you got to be careful with, especially with drug plans, is this is only going to show me the carriers and the plans that actually pay me as an agent and who I'm appointed with. So something that we want to do, since few drug plans pay us these days, is we click Add Non-Licensed Plans up here. That's going to show us all the ones in our market for drug plans. The ones that don't pay us are going to be labeled with the black flag here of non-commissionable. And we then, here's the easy thing about drug plans. The only thing that matters is not plan premium. So I always go over here and I change this. I don't care about plan premium. I care about total cost. And here's why. So this plan premium is $89 a month. But if I click a few more details, the total cost on this plan from now until the end of the year is $856. That includes the premium plus the estimated prescription cost at the pharmacy. If I sort by premium, yeah, I got a $0 premium, but look at my estimated drug cost, $2,000. So my total cost is now $2,000, not $8,000. And the only thing that matters in drug plans is total cost, right? It's a drug plan is a drug plan is a drug plan. Are the drugs covered economically? So we're going to sort by total cost. And then I can also see if the sort, let's keep an eye on this plan. United Healthcare, $89.20 a month, $856. What if I go to Giant Eagle? Still the same plan, still $856. What if I go to CVS? Still the same plan, still $856. What if I do mail order? Still the same plan, still $856. So I have just now sorted all of the drug plans in the area, 14 of them. I've checked 4 different pharmacy options, and I know for a fact that United Healthcare's plan is the lowest total cost. If I want to, I can show, and I always do this, I could show a breakdown of cost by clicking more details. Check this out. Month-to-month breakdown of what they're estimated to pay at the pharmacy. You can change this. Maybe you're meeting with somebody now who's not going to have an effective date till September. If I change this, you'll see the cost change drop to $735 because now we're starting in September instead of August. When you show this pricing, right now we're looking at Giant Eagle. Please don't say this is how much you're going to pay. Please make sure to say this is your estimated cost. Folks, it's pretty reliable and accurate, but the last thing you ever want to do is put your money on a software. Hey, these are real-time estimates. This is what you should expect to pay at the pharmacy. These are the estimates. You can print this out and give it to them. I frequently do. I'll open all of these, and they can see by month, by drug, what their copay would be for that medication at their pharmacy of choice. If they love the plan, we can add it to the cart. I now have both my MedSup and my PDP lined up. Their total premium is going to be their Part B plus $204 plus $89.20 a month. It actually adds that up for me. So $293.76 is your total premium. And then we have the ability to complete these applications right in our platform. But we don't want to do that yet, right? We want to keep in mind that $800 number for the drug plan. And this is going to be a short touch on this today. We will get way more in depth at this because quoting Medicare Advantage plans requires something that MedSups and Med Advantage plans do not require as much. And that is that you do specific market research, which we're going to teach you how to do on the plans available in your area. So I'm now on the Med Advantage prescription drug plan tab. And just like with the drug plans, I want to sort by total cost. And so it will now show me Med Advantage plans. This one's a Medicaid plan, and I'm not looking for that right now. So here's the lowest cost one, total cost. You're going to see a big difference here. Look at my total cost for premium and medications. Less than half of what my total cost was on the standalone drug plan. Now, hear me out here. You will have clients who want a med sup, but will be forced to take a Med Advantage because the prescriptions cost so much less. And if things play out the way that they're tracking, this disparity will increase even more so in the fall. Why? On this bundle plan from Medical Mutual, more reimbursement from the government. They have more funds to shift around to make this more affordable, to make medications more affordable. They also have more volume. The Advantage plan has more volume, generally speaking, than the standalone drug plan, which means bigger discounts and all those rate adjustments from pharmacies and those third parties that operate in between. So I sort by total cost. The market research, I can compare. I'm going to show you that real quick. But the market research helps me know very quickly the nuance between some of the top plans in my area. And right now in my area, they're showing 67. The market research that I've done tells me that there's 4 that I'm going to write over and over and over and over again. So your market research in late August and early October helps you narrow down the Medicare Advantage plans based on core benefits. And then from there, it's just looking at medication costs. So let me add a couple. I want to just show you this real quick, and then we're going to wrap up for today. So the other thing I don't necessarily love about sorting by cost, but there's no other way around it. One of the best plans in my market right now is through United Healthcare, and it doesn't always come up as the most cost effective because it has a $29 a month premium, where this Med Mutual plan has a $0 a month premium. Now, 0 a month, 12 a month, 29 a month. Here's the problem. Medical Mutual, Ohio only network, SummaCare, Ohio, Florida, Arizona network, United Healthcare, national network. You're paying $29 a month, but you have the largest national HMO network in the country. If you live in Ohio, where I do, you're an hour away from both the Cleveland Clinic and UPMC, two world-leading hospitals, not to mention University Hospital and Ohio State University Hospital. If you're on this plan or this plan, you cannot go to UPMC. So my drug costs are higher on this plan. They're lowest on this plan. But I'm making a big decision between the dynamics of the networks on these HMO plans in the market. And then from there, we're looking at the nuance, right? What's the max out of pocket? Med Mutual wins $3,300, Summa $45, United Healthcare $39. All have $0 office visits. MedMutual got slaughtered with enrollments. They're going to cut this next year. They had a $0 office visit for specialists, 35 with SUMA, 25 UHC. And this is where that market research comes in. We need to know, we make a spreadsheet in our market and we highlight the winner in every category. You could kind of see how that plays out. Hospital inpatient stay. Here's where we start to get to the rubber in the road. $325 per day for 6 days, or $275 a day for 5 days. What's nice about SmartEnroll, there's information here that we need to know more about. If I click view details at the bottom, check this out. A much longer summary of benefits, and more importantly, look down here. I got their prescription directory, I have their carrier provider directory, I have the pharmacy directory, and I have, most importantly, both the summary of benefits and the evidence of coverage. This is what I use to do market research. I look at the summary of benefits. Now I can really see side by side how plans compare. I can look at the dental, the vision, the over-the-counter. And folks, I'm going to try a fun experiment this year. I'm going to download all of these for the carriers in my market, all 60 some, and I'm going to put them in ChatGPT and see if it can make me a comparison spreadsheet. I think it will. I think it'll be spot on. But this is where we have to learn about those plans in our market, and there's usually 3 or 4. But if we go through that comparison, we can also again show their total cost here, their monthly prescription cost at the pharmacy, and then we could add that plan to the cart and do that enrollment right inside of our platform. Of everything that I've gone over, like the thing that needs a lot more rehearsal and teaching are the Part D plans, so the drug plan, how we go through that process. How do we help people that have extremely high cost? We'll show you some of the anomalies in doing that. And then this Med Advantage plan marketplace knowledge is something that we're going to be building together as you go through August and September. But that's our process in a nutshell. At the end of that presentation, we've shown them all these options now. We might go back to a document like I had up earlier that has, here we go. Let's go get this one instead from our website. We might bring this up because maybe they're still on the fence about do they want an advantage or they want a meds up. And this is a nice piece to kind of conclude with to give them that visual reminder of the differences between the two plans. So sort of the last thing is it's the math. Sometimes for people, you have to do the math. I'll do this for you on a Word doc real quick, but you could do this. Let me turn this goofy thing off. You could do this on a notepad, which I frequently do. So on a notepad, right? Let's do this. So no matter what you do, you have your Part B premium, so we don't really care about that, but you could put Part B premium. And let me do one more thing here and make this easier for us. All right, Part B premium, $185. Some, especially your engineer clients, are going to need the math. So then what other things can we break down for them, right? Plan premium. $202. Plan G. $29. UHC MAPD plan. Okay. Sort another row below. Drug plan. Premium. $89 a month. $0. right? Medical deductible. We have zero. Oh, no, we don't. We have $257, Part B. You don't have a medical deductible on that Advantage plan. Okay. Rows below. MOOP, max out of pocket. 257 plus. Here's the important part, because a lot of people on supplements love to say, well, I don't pay anything for my health care. Everything's covered when I go to the doctor. Categorically false. We have to multiply the premium times 12, and we have to include that as part of their max out of pocket amount, right? Because they're spending that money every single month. The same with the Med Advantage plan. What's my max out of pocket? It's $3,900 plus $29 times 12, which is $348. So here's the problem, though. I like to do this sometimes on a piece of paper too. Best case scenario, right? You remain perfectly healthy all year. Your best case scenario for expenses, really, I'm not going to include the drug plan in here for now, but really we should be including this. Actually, let's do it. Let's be really transparent with our client. Because they had to pay $89 times 12 too. That's another $1,068 in premium. Right? So we have 257 plus 2424. Actually, I'm not going to include that 257. I just want to include premium. They're guaranteed out of pocket for premium, not including Part B, is $3,492 for the year. My best case scenario on the Med Advantage plan is actually $348 a year. Because this MOOP money right here with the Med Advantage plan is a maybe. I only have to pay that if I have to use things on the plan that have a cost, right? So the last thing we could talk about with them is worst case scenario. Oops, worst case scenario. Come on, Dave. Over here, it's not too different because all we're going to do is add that 257 to the mix. That's going to put us at 37, so $3,749. Right? That's my worst case scenario. It's this plus this. So over here, my worst case scenario is the 348, the premium, plus the max out of pocket amount on the plan. Okay, 4,248. So when you look at this, if I have a really healthy year, right, I do pretty good on a Med Advantage plan because I only spent $348 on premium. And my office visits at the regular doctor are $0 a month. And oh, by the way, let's not forget, shall we? Includes dental, vision, over-the-counter money. So if I utilize those benefits, right? If I utilize those benefits, I'm actually doing pretty good because I got $1,250 in dental. I got $350 for my frames and my lenses were covered, and I actually used that. Maybe I went to the gym membership. Some supplement plans have that, others don't. So when we start to do the math, it's much closer than we realize if we have competitive Med Advantage plans in our market. So over here, I got to pay extra for same items. So my costs are higher. But again, on the MedSup, I don't have to argue about prior authorization. I can go to any doctor in the country that has Medicare. And I have very, very fixed, as you can see between these two numbers. The worst case scenario for me is a $257 financial swing from what I anticipated spending in that year. So with that, this is a really great place to stop our recording for today. And then those that are in the live session, I want to let you ask some questions because I just threw some stuff at you at the end here that's probably making you go, wow, that's a little interesting. So if you want to stick around and chat a little bit, great. I'm going to go ahead and close out the recording. And if you're listening to this after the fact, don't hesitate to reach out. We'd love to talk to you about what we're teaching. And we wish you well.